2024 session of talk series on tackling air pollution through clean cooking. This session and the talk series is organized by Modern Energy Cooking Services Program through its in-country partner Finovista and with the partnership of Women in Modern Energy Cooking, an initiative aimed at enabling a women-driven approach for gender equality in clean cooking. Coming back to today's session, air pollution is a significant global health concern, and with millions of people being exposed to the harmful pollutants, burning of solid fuels by households for their cooking, heating, and other energy requirements is one of the largest sources. And household air pollution caused by burning unclean fuels is estimated to be responsible for 2.3 million deaths worldwide each year. Specifically in low income and in rural areas, traditional cooking methods involve open fires or rudimentary stoves, disproportionately affecting the health of women and children across the globe. We've put this session today and we joined up with a stellar panel of experts. And the idea in this session is to understand that how clean cooking solutions can play a vital role in reducing the air pollution and climate change challenge. We would specifically try to understand the impact on human health and economic costs and productivity loss due to HAP. Also, understanding the global and national standards prescribed for the household air pollution caused by burning of unclean fuels for cooking. We will also try and understand a little bit about strategies which can be integrated in public health policies with that of economy, environment, and housing design. But before we do that, for all those of you who've joined us for the first time, would just like to give you a short introduction about Modern Energy Cooking Services Program, which is a UK-aid FCDO-funded global research program led by the Loughborough University, UK. And the program works towards enabling the transition towards modern energy-based cooking solutions and services globally. The research under the program spans on a range of modern fuels, but there is a strong evidence for the viability of electric cooking through energy efficient devices. In India, this program is led by Finovista as an in-country partner, and we work on a range of strands which covers research to support policy evidence, promotion about electric cooking, working towards enabling finance, working towards enabling the supplier ecosystem in India. Moving forward to the initiative of Talk Series, which has been created under this program. Talk Series we see as an important tool in MECS program in India and globally also, establishing a platform of stakeholders from modern energy, cooking, and allied sectors to discuss most pertinent issues critical to transitioning of clean cooking sector. We see this platform as a growing tribe or a community. We've already concluded two phases of this talk series sessions, which each phase having 12 sessions each, and we're already on the third phase of talk series with a growing tribe of global registrations of more than 2,000. And we see at a very important tool for enabling clean cooking in India and globally. We've already talked about the current session that's going to be, and just a small information about the next session, which is going to be conducted on 22nd February, and it talks about e-cooking for institutions. I'll stop for here, and with this, I would like to invite our first panelist for today's session, which is Dr. Wenlu Ye. She's the Technical Officer, Air Quality, Energy and Health Unit, World Health Organization. And her role involves providing support for the team's technical and capacity building activities related to household air energy, household air pollution, and their health impacts. Dr. Ye holds a PhD in Environmental Health Sciences from Emory University, and she's completed her postdoctoral training at the University of California, Berkeley. With over 7 years of experience in researching household air pollution and household energy interventions, Dr. Ye has been involved in various projects in China, India, Peru, and Rwanda. Her work focuses on assessing household air pollution exposure, its associated health impacts, and the effectiveness of household energy interventions. Dr. Wenlu, I would request you to please take over your session.
Thank you so much. Thank you so much for the introduction, and I'm very glad to be here, and thanks for the opportunity to present here. So for today's talk, I would like to give you an overview of WHO's response to household pollution and clean household energy. Next slide, please. So I'd like to start today's presentation with a brief introduction to this WHO guideline for indoor air quality, household fuel combustion, because this is the first health-based guideline on household clean fuel and technologies in response to the urgent needs to reduce the household pollution exposure and associated health impacts. This document provides practical and evidence-based recommendations for achieving the WHO Global Air Quality Guideline. Specifically, it includes recommendations on what fuels are considered dirty for health, such as kerosene and unprocessed coal, and we recommend people to avoid using those. And also, there are recommendations on the needed performance for clean household fuels and technologies through emission rate targets to meet the WHO PM2.5 and carbon monoxide air quality guidelines. Additionally, this guideline recommends the importance of addressing all household energy uses, not just cooking, but also heating and lighting to ensure the benefits for environment and health. Next slide, please. It is important to know that WHO defines clean fuel and technology for health at point of use based on the emission rate targets for PM2.5 and CO provided in the guideline for indoor air quality, and which are linked back to the level recommended in the WHO Global Air Quality Guidelines. And one caveat here is that the clean depends on the fuel and technology combinations. And so if a biomass stove or cooking system meets the emission rate targets for PM and CO, it can also be classified as clean. And the fuel and technologies that are known to be clean to health are solar, electric, biogas, natural gas, LPG, and alcohol. Next slide, please. And so to support countries in identifying or implementing the clean cooking solutions and help country achieve WHO Global Air Quality Guideline, we developed this CHAST, the Clean Household Energy Solution Toolkit. The CHAST toolkit includes 6 different modules with resources to facilitate evidence-based clean cooking or energy policies and programs from different aspects. Next slide, please. So module 1, the first module, stakeholder mapping and situation assessment, it provides a foundational understanding of country's existing household energy situation. And this module features several tools. The first one I would like to mention is a Household Energy Assessment Rapid Tool, or HART. It's used to map stakeholders and assess the current situations of unclean household energy situation for a country. And the HART tool is actually a template that a user can use and to evaluate the national household energy context, existing policy and programs, and also to map out the stakeholders in energy and health sectors. And this HART assessment has been conducted in 15 countries and including India. So this module also features sorry, I haven't finished, yes. So this module also contains several other useful databases on household energy use, associated health impacts like mortality and morbidity, and household air pollution measurements for both indoor concentrations and person exposures. Yeah, next slide, please. So after countries get an understanding of their current situation of household energy use, stakeholders, gaps, and opportunities, the module 2 helps them to identify the technological and policy interventions that would help countries to explore how different fuel technologies and household energy policy options can affect health, environment, and other outcomes. And module 2, I would like to highlight this BARHAP tool, benefits of action to reduce household air pollution. This is a planning tool for estimating the costs and benefits of different interventions that aim to reducing the cooking-related household air pollution. This tool currently included 6 different clean cooking transitions, and for each cooking transitions, user can specify a policy interventions to apply there. For example, the stove and fuel subsidies, financing, or intensive behavior campaigns and such. And the other useful tool in this module is the household multiple emission sources model. This model could help to predict personal exposures and the kitchen concentrations of household air pollution associated with the use of up to 3 different devices for cooking, heating, and lighting. And the user can also specify parameters such as air exchange rate, daily cooking time, and so on to see how that would impact on the personal exposure or indoor concentration. Next slide, please. So for module 3, it facilitated the development of national performance standard for cooking, heating, and lighting devices, and with a focus on emission of harmful pollutants and the safety risks. So WHO has worked with International Organization of Standardization, or ISO, to develop testing standards and voluntary performance target, or VPTs, for cook stove and clean cooking solutions based on their efficiency, emissions, safety, and also durability. But this ISO VPTs are developed based on global default values for cooking time, ventilation, and kitchen volume. And when these values are not relevant to a country's specific context, we also have tools for country to use, like this performance target PT model, to calculate and set locally specific targets for stove performance using the country-specific data on cooking time, ventilation, and kitchen volume. And to facilitate this process, WHO also developed a step-by-step guide, input value database, and a protocol of collecting input values if they are not available to support country to use these tools and set national voluntary performance targets for cook stoves. Next slide, please. The next module, module 4, monitoring evaluation. This module offers guidance and tools for monitoring and evaluating the impacts of household energy interventions on air quality, health, or livelihood. And the tool featured here is this core question on household energy use. These are standardized questions designed to be integrated into national surveys or censuses to assess the household energy use, transitions, and also track the progress toward increasing the use of clean fuels and technologies. And along with that, so we also developed this user guide to help users to administer these core questions and provide step-by-step instructions. Next slide, please. The last 2 modules, module 5, engaging the health community was developed in recognition of the important role of health professionals in helping people to understand health risks associated with house air pollution. And so for that, WHO is developing this air quality, air pollution, and health training, APHT toolkits for health workers. We also work with the University of Liverpool to develop the training material and job aid for community health workers to convey messages on house air pollution, associated with health risks, and clean household energy solutions to the community directly. And for the last module, we emphasize the importance of raising awareness of house air pollution impacts and suggest community strategies. And so for that, I would like to mention that 2024 is actually the year of clean air, and WHO is working on revamping our Breathe Life campaign. And we're currently planning to launch this campaign very soon, so we will update the clean cooking communities in the next few weeks. Next slide, please. Yeah. So the last thing I would like to briefly touch on is this UN Energy Policy Brief, co-led by WHO and the World Bank. So we all know that there are interlinkages between house air pollution, climate, and health. And so this document proposed a global roadmap to achieve universal access and net zero emission in the cooking sector. And then this document provides key milestones and priority actions, and also expectations for country to adopt this global roadmap into their local context and also develop their own national level roadmap. For example, the top priority for low and middle income countries that is still largely related on polluting fuel and technologies. They may want to prioritize ensure access to clean cooking for all, and for high income countries or high income area, they should work on decarbonize their own cooking and heating sectors to align with the net zero goal by 2050. Next slide, please. Yeah, so this is a figure show you the detailed target and the share of population gaining access to tiered cooking solutions between 2020 to 2050. I won't go to details because I know I'm probably already over 10 minutes. So I will just highlight, brief highlight the milestone of this roadmap. Next slide, please. Yeah, so basically we have envisioned the 3 key milestones on the pathway toward net zero. The first milestone is to eliminate cooking poverty, and the second milestone is to achieve universal access with MECS and accelerate the decarbonization of cooking fuels by 2040. And then by 2050, we will achieve net zero for the cooking sector. Next slide, please. And so this document also gave several priority actions. And so the first one is to mobilize the political commitment at highest level. And we will also encourage our government to strengthen and integrate clean cooking into their energy and climate policy. And also national government should integrate clean cooking demand into their energy planning and strategy development, and then translate into concrete trajectory and action plans. I believe that's all I have today. Thank you so much. I'm happy to take any questions after the panel discussion. Thanks.
Dr. Wendu, thank you so much for this informative session. And I think giving us a visibility into this, resource repository was, we're really thankful for that. And there are a lot of questions which will be put forward in the next session. And I think Dr. Yasmin Khalifa, our moderator for the panel discussion today, would be reaching out back to you and calling you back in the panel discussion. Thank you so much. Now we are joined by our moderator for the panel discussion for today, Dr. Yasmin Khalifa, who's the Research Associate at Loughborough University, UK. Dr. Yasmin's research interests fall in the field of sustainability science and using transdisciplinary approaches to explore and drive sustainability transformation at the interface of technology, policy, and society. She holds a PhD in Environment and Sustainability from Keele University, UK, which focused on exploring opportunities and challenges of sustainable resource management in developing countries. Dr. Yasmin, I would request you to please move forward with the next session, the panel discussion, and invite your panelists for the day.
Thank you so much for the introduction, Sheetal, and such a great opportunity today to discuss such an important topic, air pollution, and how to address this challenge with global challenge, actually, with adapting clean cooking solutions and interventions. And I would start with introducing the panelists first, and then move on to Dr. Matthew's presentation. So our panelist today is Professor Palit, who has more than 26 years of experience working in the domain of renewable energy, clean energy access, rural electrification, distributed generation, microgrids, and energy transition. He is featured in the top 2% world scientists ranking by Stanford University for the last 4 years in a row. Dr. Palit is a professor of energy at the NTPC School of Business, New Delhi. He was earlier with the Energy and Resource Institute, a global research and policy think tank, as a director and senior fellow, and led the Rural Energy and Livelihood Division in the Energy and Resources Institute for almost a decade. Professor Palit has published 3 books and around 150 research papers in reputed scholarly journals, conference procedures, books, and magazines. Professor Palit holds a master's degree in physics, postgraduate diploma in non-conventional energy technology, and PhD in energy policy. Our next panelist is Dr. Matthew Schupler. Dr. Matthew is a postdoctoral fellow in the School of Public Health at Harvard University and research fellow in Department of Public Health, Policy and Systems at the University of Liverpool, where he is the quantitative lead for the Clean Air Africa study. Matt's research is focused on reducing the adverse health and climate impacts of household air pollution from the use of polluting cooking fuels, such as wood and charcoal. He has previously worked as a Global Health Fellow at the Clean Cooking Alliance and collaborated with the World Health Organization and Institute for Health Metrics and Evaluation to improve the global burden of disease methodology for assessing the health impacts of household air pollution exposure. Welcome to the panel today, and we'll start with Dr. Matthew. Can you please share your presentation with us?
Thanks, Yasmin. Yes, sure. Great. So thank you again, Yasmin and Finovista and Modern Energy Cooking Services for the invitation to present. So I think I will build on Yen Lu's presentation and do a quick overview of some more of the health effects of air pollution from cooking. So as was mentioned in the previous presentation, there are clean and polluting fuels. This was research done showing average PM 2.5 exposures, which is one of the most important pollutants for health when it comes to assessing the health effects of household air pollution from cooking. I just want to direct your attention to the red bars here. So this is from a multinational study conducted a few years ago across 8 different countries. And we see that gas and electric fuels here have the lowest levels of PM 2.5, so between 50 and 60 micrograms per cubic meter, whereas other polluting fuels, which consist of biomass fuels and kerosene, these are much higher. And this is for average female exposures and male exposures from this study. So the important thing to note is we do see much cleaner levels, and this has been replicated in numerous measurement studies. However, levels still remain high. 50 micrograms per cubic meter is above the WHO interim target level of 35. So in the previous presentation, they mentioned WHO's air quality guidelines, and so levels are still high, and I'll get into reasons why that may still be the case. Firstly, we know from studies that air pollution levels within the same type of cooking fuel also vary substantially. So this is measurements from the same study, and all these measurements are made from households cooking with LPG, or liquefied petroleum gas. And in the top box here was female exposures. You could see the wide distribution of PM 2.5 exposures here. So the x-axis is showing the range. So in certain countries cooking with LPG, such as Chile and Colombia, which is in the red and green, we see that the distribution of gas exposures is below the WHO guideline. However, in other countries like Bangladesh and Pakistan, we see levels above 100 among households cooking with LPG. And this just illustrates some of the challenges with identifying the health effects. Even among households cooking with LPG, we see a large distribution. And so because of that, demonstrates why we need to collect measurements across different countries, because when you provide someone with an LPG stove, their exposure is not the same across different countries. I also wanted to highlight work done, as was mentioned by our group at Clean Air Africa. This is new research we conducted across different communities. And these are peri-urban communities, so rapidly urbanizing. I just wanted to highlight in this table below at the bottom some of the key findings. So one of our communities was in Obuasi in Ghana. The other one was in Eldoret in Kenya. I've highlighted those in yellow here. And so we measured PM 2.5 kitchen concentrations for 24 hours, and we compared them across fuel types. And so in this table, I have LPG at the top row here and charcoal at the bottom. And interestingly, in Obuasi, we see almost no difference in average PM 2.5 kitchen concentrations. It was 52 among LPG users and 56 among charcoal users. Whereas in Eldoret, we see a substantial difference, 61 micrograms per cubic meter among LPG users versus 297 among charcoal users. So again, highlighting large differences in the relative difference between LPG and charcoal. And so I think this demonstrates that the potential health effects from switching from, say, charcoal to LPG in these two communities would be very different. So again, highlighting the need for measurements to better understand how well clean cooking interventions can actually reduce PM 2.5 levels. And then finally, I wanted to highlight the potential reason for these differences. So we had some data looking at other factors aside from fuel type. So on the left-hand side here, I have a graph showing the time that the participants left home during the monitoring. So we monitored the primary cook. And just shifting to the bottom graph in Ghana, we see here that individuals that reported leaving their household during the monitoring, so 1 to 4 times, had consistently higher exposures throughout the day. So this is the hours of the day versus those that remained indoors. And so what this suggests is that they were exposed to outdoor air pollution that was likely driving up their exposures. And we actually found in this community, for example, that LPG users were more likely to leave their home and also live closer to roads. And so they may have been more exposed to ambient air pollution. And so we see that again on the graph on the right-hand side, that those that live closest to a road, which is the red line here, less than 5 minutes, consistently had higher exposures. So this result is suggesting that ambient air pollution is playing a large role in their overall exposures and may potentially limit the effectiveness of clean cooking interventions. And again, I'll mention these were in peri-urban areas, which we know are rapidly urbanizing. There's a lot of other sources of PM 2.5. So in the previous presentation, their WHO went through several of the tools available. I wanted to just highlight another one called Abode, which is kind of a newer version of Habit, which was developed by Ajay Polarisetti. And so these are tools we can use to actually measure or project the health effects from PM 2.5 exposure reductions. This is something that can be very useful, linking PM 2.5 to health effects using variety of exposure response functions. And the website to access that is at the bottom. And then I just wanted to highlight some other work. I was not involved in these trials, but I think it's useful to highlight some of the complexity of linking household air pollution to health. Some of you may be familiar with the HAPPEN trial. They just released several papers I have here on the left-hand side about the impact of clean cooking on several outcomes. So at the top, we have infant pneumonia, stunting in infants, as well as birth weight. The investigators here didn't find significant associations between reductions in PM 2.5 and these different outcomes. This other study on the right was conducted a few years ago in urban Nigeria, and they looked at fetal growth. This was also intervention during pregnancy, and they also didn't find significant association. I wanted to highlight something that the authors mentioned in one of the papers to show this complexity. They provided potential explanations as why they didn't find an association between PM 2.5 exposure reductions and their outcome. So they did find a reduction when providing households with LPG, but it didn't lead to a significant reduction in pneumonia. And so one potential reason is that a high percentage of their participants in the RCT were vaccinated against pneumonia. And so that made bacterial pneumonia less likely to occur, which may have reduced the incidence and therefore may have led to this null finding. The study also occurred during COVID, which reduced respiratory virus circulation. So therefore, they may not have had enough cases to lead to a significant result. In addition, it may be the case that PM2.5 exposure levels need to be lower. So they did lower the exposure levels among the intervention arm, but it may not be low enough. Also, it may be the timing of the intervention of when the households actually got access to LPG. It may have been too late, and the exposure may need to be reduced earlier, potentially during gestation. So all of these factors to say are to highlight the complexity of actually linking PM2.5 to health and show just the complexity of carrying out these studies and why it's quite a challenge. And then I'd quickly just like to end in the last couple slides showing other benefits aside from PM2.5 exposure reduction. This is work that we've done at University of Liverpool and with several of our partners in Kenya. So we know from other studies that one of the main impacts of providing access to clean fuel is gender equality, which is one of the Sustainable Development Goals. In many low and middle income countries, that women are typically the primary cook, and not only do they have to cook, but they have to gather their fuels if they're using, for example, fuel wood, and that could take a significant amount of time. Studies have shown up to 20 hours per week, especially if they're living in rural areas. And this contributes to something called time poverty. So the amount of time that they spend on fuel collection may displace time for other activities, which can include generating income or education. And so this is a huge source of poverty in general and also time poverty. And the World Bank has estimated that the impact of this is contributing to almost $1 trillion in lost productivity because of this time poverty. And so other work that's been done and pushed by the Clean Cooking Alliance is to actually identify other co-benefits. And so something that I've worked on is actually looking at how primary cooks, particularly women, may use their time. So we know that there's typically time savings when switching from a polluting fuel to a modern cooking fuel. And so how women use their time can have an impact on their income. So we know that if gained additional time, emerging research has shown they can actually take on new employment, gain additional income, and in some cases they can also cook food faster and cook more meals, which can also impact their food security. There's a new report I just want to highlight released by Clean Cooking Alliance a couple months ago showing the link between clean cooking and food systems. And so finally, I'll just highlight some research that was done in a formal settlement in Nairobi. And so we surveyed new LPG customers using a pay-as-you-go service. And we found, based on this study, I believe it was around a few hundred households, that over 60% of women who gained access to pay-as-you-go LPG reported taking on another job. And this was women that were the head of household. Those that were in households headed by males or their spouses, it was about 40%. So we see a large difference here. But nonetheless, over half of women reported additional income from just the time saved when switching from their polluting fuel to pay-as-you-go. We also asked women to self-report how the access to pay-as-you-go influenced their diet. And we found that among those that were the household head, approximately 15% reported eating more diverse foods in their diet, and between 10 and 15% reported consuming more carbohydrates and more protein. And this is due to a variety of reasons about having more time to go grocery shopping or being able to cook multiple meals on the double burner stove. And so all these can have positive benefits on nutrition and food security. And I think this is something that increasingly needs to be measured in these intervention studies. So I'll stop there because I know we're short on time, and I'm happy to answer questions during the panel discussion. Thank you.
Thank you so much, Dr. Matthew, really sharing key findings, interesting key findings from your research and showing the complexity of measuring air pollution, household air pollution and the health impacts. I'm sure that we'll have a lot of questions for you when we start the Q&A session. But let me go first to our next panelist, Professor Pellet. Can you please share with us your thoughts on the air pollution, and how can adapting clean cooking solutions and interventions can improve the air quality, the household air quality, and the health impacts as well. Professor Pellet, over to you. You're unmuted. Can you please?
Oh, yeah. So thank you, Yasmin. So it's a pleasure to be here to share my thoughts. I don't have a presentation, so I will just pick this one and share my thoughts on this very important subject. I work in the energy sector, primarily in the energy sector, not in the air pollution sector. So I would try to share my thoughts from an energy perspective, why it is important to have cleaner energy sources so as to reduce the air pollution, both ambient and within the house. This one, and I must say that Dr. Wynn made a presentation on the CHEST program of WHO. So while I was in Terry, my team actually did the CHEST study for India. So we had some fascinating findings as part of that study. This one, I'm sure that WHO has taken care of those recommendations that we had made at that point of time. I think it was in 2019 that we had done the study. This one. So, well, having said that, well, in India, we all know use of solid biomass in inefficient cook stoves, resulting in more than 1 million premature deaths every year. So, of course, these numbers are based on some models. This one, so we might debate on whether how realistic or correct are the number, but the broader fact is that a lot of people are dying prematurely, or the morbidity is also high because of the use of solid biomass in inefficient cook stoves, and that's been the case in India for quite long time. So if you see, if you review the data for electricity or lighting and for cooking, you would see from the census data from 2001, 2011, then 2011, or before that, there has been a decrease in the number of people who uh, who are using, who don't have any access to electricity. So there's been a very sharp decrease from 1991 to 2001 to 2011, and then if we do a census now, probably all households, or at least more than 99% of the household will see that have electricity connection. But if we see the same census data for cooking, then we can see that whether it is in 1981 or 91 or 2001 or 2011, the range of people who are using solid biomass is something around 60 to 70%. For at least for those 4 census. So while there has been a huge increase in the electrified households over a period of time, despite different government programs, right from 1992 when the government launched the national program on improved cook stoves and national program on biogas development, there has not been a substantial decrease in the number of people who are using inefficient cook stoves, and this is because of various reasons. This one of course is a behavioral aspect. People feel that cooking food in using firewood gives a better taste, but there are also other economic reasons, supply chain issues, technical issues, and so on and so forth. This one, so that's an area where I think we have to see how we can make an impact so that people can move very fast towards efficient cook stoves, and I will discuss more about it later. But more importantly, a figure was shown by my previous presenter, this one, that how the ambient air pollution is also contributing to the household air pollution. There is a WHO report which says that, at least in Indian's context, which says that 25% of the, roughly around 25% of the ambient air pollution, especially in North and Central India, can be attributed to the high household air pollution. Now, that's the point I'm trying to make, is that the household air pollution is contributing almost one-fourth of the total ambient air pollution. That again, that air is coming back, the unclean air is coming inside the house, and it's become a cycle. So we have to see that where we can make a more impact. If we can address the problem of household air pollution, probably a large percentage of the ambient air pollution will also get addressed, and the same air will not come back inside the house. So it will become a virtuous cycle instead of a vicious cycle now. So that's an area where I think we have to look at it, how we can address the issue. The third point I would like to highlight is that the toxic fumes from the solid biomass also have a negative effect on the climate. We all know the solid biomass contains black carbon. The soot contains the black carbon, which is which is the highest radiative forcing after CO2, and is almost 1500 times stronger than CO2 per unit of mass. That means the greenhouse gas impact is 1500 times stronger than CO2. But thankfully, black carbon is short-lived pollutant, so it doesn't remain in the air. And if you can address this one, it remains for a very short period of time, unlike carbon dioxide, which remains for many years. This one. So I think these three data point clearly shows that why household air pollution is an important issue and why we need to shift towards a cleaner cooking. We can discuss whether the cleaner cooking should be through LPG or through a more efficient biomass stoves or electric cooking or maybe other sources of energy. But the first, nobody can deny that this is an extremely important issue, and across India, it is important that we need to shift towards a cleaner cooking systems. This one. Now, let me now say that means, despite the government of India, now government actually recognized this problem, and government came out with a Prime Minister LPG scheme, Prime Minister Ujjwala scheme, PMUY, basically to provide LPG connection to all the households who don't have LPG connection. This one, and it's a huge program. Almost roughly around 96 million stoves have been distributed already, and another 7 million are planned to be distributed from 2023 to 2026. So roughly around 100 million households in India would have LPG stoves. This one, but the challenge is that despite such a large number of households having LPG stoves, and the connection has been provided to more than 98% of the households in India. The question is, do all households use LPG for their cooking? So I think the National Family Health Survey of 2019-21, it shows that only 59% of the household in India use clean fuel for cooking. 41% of the households continue to use solid fuel for cooking, especially in the rural areas. 94.8% in urban and rural India, and this is very important, almost equally in urban and rural India. That means in urban area also, in informal setting, the biomass cook stoves are being used in many cases, if not in all cases. And states having more than 40% of the households using solid fuels for cooking are states like Haryana, Himachal, Rajasthan, Uttarakhand, Chhattisgarh, MP, Madhya Pradesh, Uttar Pradesh, Bihar, Jharkhand, Odisha, and West Bengal. So mostly the northern India and the eastern India states. So there is a huge inequality in the use of clean cooking systems also. And a very important figure from a health perspective is that the prevalence of tuberculosis is 179 persons per 100,000 in household using electricity, LPG, PNG, and biogas, that is the modern cooking energy. Whereas the number is about 490 persons per 100,000 in household using biomass. So that clearly shows why why it is very extremely important, purely from a health point of view, and of course from air pollution point of view and energy point of view, that is clean energy point of view also, that why we should shift from, or why we should have policy measures and programs to make us shift from the unclean fuel to a cleaner fuel source. As I said, the government wanted to do that. Whether the government has been successful or not, I think I can discuss this. I'll stop here and I'll discuss later.
Thank you very much. Thank you so much, Professor Khalid. And I'm sure we'll gonna come back to you with a lot of questions, because I think there is a lot of socio-economic inequalities between urban and rural areas, and we need to ensure equal access to all people, right? So to clean cooking. So now I would like to go back to Dr. Winlo. Yeah, thank you so much for your presentation and sharing with us the WHO work in this area and tools and methods that they have developed and everything. And my question now is, what are the challenges applying these methods at the global level? Can you please share with us how these are being used at the global level, and what are the challenges that the WHO is facing in collecting data, especially in countries where the data is missing?
Yeah, thanks. That's a great question. So I will start with the second part of this question. As you know, like WHO is a custodian agency for SDG 7, which is to ensure access to affordable, reliable, and sustainable and modern energy for all. So we're actually responsible for collecting data for SDGs 7 indicator, 7.12, I believe. It's the proportion of population really on clean fuel. And so we're collecting data every year, and we release the results in the tracking SDG 7 reports each year. And so this year, the report, the statistic will be released by the end of April, and the full report will be released by the end of June. And so the questions that we use to collect this data is mainly what is the primary fuel you use at home, right? So this is not really accurate to reflect the personal exposure on household pollution, because how do you really define a primary? So if you are using two different fuels together, and if you use those one slightly more than the other, and then we'll consider this as a primary fuel. And another thing is, as I mentioned, we only address cooking, and there are other sources like lighting, heating. These are important, but the current survey question are not able to capture that. And the third area we hope to improve is, now we only know the primary fuel, and then what about the second and third, and how's the fuel stacking look like, and how's the fuel transition look like in the household? This part of information is largely missing. So that is a major challenge we're facing for collecting the household fuel data. And another thing I'd like to mention, that because WHO has this global air quality guideline, and so that is serve as the basis for the national government to develop their own national ambient or indoor quality standards. But this part is beyond WHO's work. So WHO can only provide this guideline, but how would each national government would do, and how they actually bring the standards into their legislation, this part is beyond our scope right now, but we have been requested to help this kind of work a lot. And so this is actually a challenge and something that we would spend some time to work on in the next few years. Thanks.
Thank you so much. Thank you so much, Dr. Winlo. Yeah, of course, I understand that the measuring the impacts of the air pollution is really challenging for countries, especially when you want to collect this data at the local level. It gets more difficult. So my next question to Dr. Matthew, if you can please share with us from your research, and I know that you've done a lot of research in different countries, what was the most reliable and accurate method that can be used to measure the household air pollution and the health impacts?
Thanks for that question, Yasmin. Yeah, so there are a variety of air monitors that we use, and the good thing is they are typically becoming cheaper and easier to operate, which makes collecting this data important. As I mentioned, air pollution levels vary dramatically due to contextual factors. It could be primary fuel, as Wenlu mentioned, secondary fuel, tertiary fuel, ventilation, and other factors, which is why it's important to use these monitors to measure the air quality. We typically use monitors that use these filter-based methods, which are the most accurate. However, I wanted to mention that there are more cost-effective options that are increasingly being used for household air pollution and outdoor air pollution. These are these low-cost sensors. And so there's a lot of thinking in the community about how we can strategically deploy these sensors to get more measurements and calibrate them to more accurate filter-based methods. And so a lot of that work on exposure assessment, including monitoring in kitchens, monitoring outside the home and ambient air pollution, having participants wear the monitors to get a better idea of where all their exposures are. So we know not everyone is entirely indoors the entire time. They also go outside their home. And I think it's also important to link that with the amount of time they're cooking. So if we can try to understand their exposures during cooking and when they're not cooking, to kind of understand the overall contribution of household air pollution to their overall exposure.
Yeah, thank you very much for clarifying this. And my next question will be for Professor Pellit, please. So Professor Pellit, from the discussion today, we know the WHO standards and guidelines for household air pollution, and the opportunity for the adoption of clean cooking solutions and interventions. So I want to understand more about the government in India, about their initiatives to ensure equal access between the rural and urban settlements, because I know that it's a large, a large percentage of slums and informal settlements in India. How does the government ensure that these guidelines are implemented in these areas and integrated into the planning process and strategies?
Okay, Yasmin. So as I mentioned in my previous just now, that the government has this big program called this LPG program, or Pradhan Mantri Prime Minister Ujjwala Yojana, this one Ujjwala scheme, so PMUY. So this scheme has been instrumental in providing access to LPG connection, I would say, to almost like 96 million households as on 31st March 2023, and this has increased now from 2023 onwards. Another 7.5 million households are being provided connection. These connections are being provided free of cost. So till 2016, till the launch of this particular program, we had maybe around 40% LPG connection rate in India. Now this has increased to almost more than 99%, and this one. Now that's the first step, the stage that the government has done, that is providing connection to all. There are challenges whether the adoption rate is high or not. I will come to that. The problem the government also realized, and because many researchers represented to the government that talked about the informal settlements. So if I take a connection, say in a rural area in one state, if somebody is from Bihar and taking a connection in his village or in her village, this one, no. And the government program says that you cannot take two connections, and the government data will then always show that he or she already has a connection. Then what do you do? And the person is in Delhi, say, doing migrant labor, this one. So the government, under this new, this one 7.5 million new connections that will be provided, a person, if he is staying, maybe his house has a connection, and if he is temporarily staying in an urban slum or an urban area, this one doing his job, then he can take another connection, this one. So that is also allowed. You can actually transfer your connections from one place to another. So that is also allowed. So more flexibility is being provided in getting the connection. What the government also done is that now, earlier we used to have 14.2 kg refills. Now there are smaller refills, and those refills you can easily get from a fuel station on this one at a market price. Of course, this if you want to pay the market price, you can easily get them and use them. So the informal settlements can easily get those. If you don't want to take a permanent connection, then also you can use LPG by taking those type of this one smaller refills from the LPG from the fuel stations. This one. So more flexibilities have been introduced into the program, so that more and more people who have been maybe because of not their fault, they were not getting the connection, so they can also be covered. In addition to the LPG, we have been telling the government that the government program should be technology neutral. This one. So the government has also launched a program called Go Electric, primarily to introduce electric stoves, which incidentally are much more cleaner than the LPG stoves because it doesn't emit any carbon also. LPG stoves, maybe it is not emitting particulate, but it is emitting carbon. This one. So electric stoves directly, at least, are not doing that. And if it is connected with solar or other renewable energy, it is you can say it's the most cleanest of all. So the government also has launched this this electric program, and the government had decided that one of the government agencies has very recently released a that means a program providing electric stoves in rural areas. This one, it's about 1 million stoves or something like that. This one of the government committees, which has been steered by the the Ministry of Petroleum and Natural Gas, they said that by 2030, 25% of our population should have electric stoves, and the government is working towards that. The Niti Aayog, which is the government planning body, very clearly mentioned in its planning report a few years back that electrifying rural energy demand would be the key program. This one also has to shift towards more use of electricity in the rural areas, including electric stoves. In addition to that, biogas is getting a lot of new promotion. Compressed biogas and mixing compressed biogas with the piped natural gas is another program that the government has launched. This one. Also, hydrogen is being mixed with piped natural gas and is being experimented in some states to see that we have a more cleaner option from a carbon point of view. This one. So these are the various programs that the government has launched and trying out different models without being focused on one particular technology, and trying to see that how we can move from an unclean source to a more cleaner source and reduce the both household air pollution and ambient pollution.
Yeah, thank you so much, Professor Palit, for highlighting all these governments' initiatives, the government in India, their initiatives, and I think that the transition to clean cooking will happen, but gradually. It will not happen at once. It will take some time, but at least we are on the right direction to ensure equal access and universal access to maybe by 2050, the net zero, as the WHO highlighted, these are the key milestones, 3 key milestones. The first is access to clean cooking solutions by 2030 and modern energy cooking interventions by 2040 and net zero emission cooking solutions by 2050. And we're happy to see that this is the transition is happening in different countries. And my next question now will be back to Dr. Winlow, please. Yeah, so this will be my last question in the panel discussion, and then we will move on to the Q&A. So you mentioned a lot of the WHO standards and guidelines for the air, household air pollution. And I want to understand from you more about the impact on women and children health. Can you please give us more details on this?
Yeah, sure. So because women and children, they are like stay home longer and they are potentially exposed to more house air pollution than men. And also women and children, they may spend time on cooking or collecting fuels. And then there's like Dr. Schupler mentioned, the time poverty there. And then so that may limit their opportunity to attend education or improve their livelihood and such. And from the health perspective, especially for pregnant women and children, we know that house air pollution has a lot of negative impacts. For example, for like a gestational blood pressure, or stillbirths or low birth weight, this kind of outcome has well-established scientific evidence. And like Dr. Schupler mentioned, the HAPPEN trial, which I personally involved in. And so pregnant women and children health is actually the main priority of this study. Although the intervention didn't show much impact, but actually we are also conducting exposure response. So there's a clear linkages between the exposure to specific pollutants, for example, black carbon with low birth weight, especially in India. That part is quite clear. Yeah.
Okay, thank you so much for highlighting this for us. And now I will move on to the Q&A questions because we have a couple of questions here in the chat. So the first question is for Dr. Winlow. So it's, they are saying many thanks for the presentation. Could you say something about the nonlinear relationship between indoor air pollution and health effects? For example, that reducing emissions and hence exposure by, say, 80% does not reduce the health impacts to such a great degree. So what does that say about appropriate choices of cooking fuel and about fuel stacking?
Okay. If I understand this correctly, I guess that's asking about the emission rate targets that we provided in the guideline. So the logic for that is when you have this cook stove or any cooking technology meeting the emission rate target for PM2.5 and CO, and that is your only sources, ideally, and you will likely to see your exposure levels under the WHO air quality guideline, like in term target 1 for PM2.5 of 35 microgram per cubic meter. But in reality, we know that is unlikely because each household, they have multiple devices. And also you have different sources like garbage burning and smoke coming from your neighbors and like traffic, and also ventilation play a role here as well. And so based on current evidence that or the study I have involved in, you have to really have all your devices at home to meet these standards and limited other sources in order to see actually exposure that low enough to really bring you the health benefits. Yeah.
Thank you. And so we just want to ensure that the presentations will be shared with all participants after the panel discussion. And our next question is for Dr. Matthew. It's from Professor Matthew Leash. And he's asking for the causes of PM during cooking. What is the role of the cooking process itself, for example, frying as a source of particulates as opposed to fuel combustion? Does this explain how electric cooking can be generating PM in the kitchen? Does this mean more attention should be on changing cooking practices, for example, using lids alongside fuel switches?
Thank you. So in the one graph I presented, there were high levels, or not high, but some levels of PM and also black carbon. And that is actually the overall exposure. And so there wasn't actually any emissions generated from electricity. It was likely because most of their electric cooking in that study occurred in China, where there was higher levels of ambient air pollution. So the reason why levels, for example, were higher among those using electricity than gas in that particular study, I think was mostly driven by exposure to outdoor air pollution. These were exposures and not kitchen concentrations. So even if you have no emissions when you're using an electric stove, if you travel outside, you're exposed to high emissions from outdoor pollution that's driving up your overall PM2.5 exposure. So that's why we see higher levels of PM2.5 and also black carbon or soot when that's not emitted from electric cooking. But I also will say that if you are cooking with gas or a polluting fuel that does emit some PM, that the type of cooking can impact the PM2.5 levels. So yeah, of course, if you can practice some ventilation techniques, covering using lids or especially ventilation, like fans or opening windows or doors, that'll also be useful. But I think something that needs to be a focus in our community is, if you're increasing your ventilation and increasing opening doors and windows. If the ambient outdoor air pollution is higher than in indoors, that may not actually be helpful in some settings. So, but yes, there are a variety of other factors, as we mentioned, aside from cooking fuel, like ventilation, that can impact your exposure.
Yeah, thank you. Thank you for explaining this, Dr. Matthew. And I think we don't have any more questions in the chat box. Do you have any other thoughts that you would like to share with us today, Professor Khalid?
Yeah, just very quickly, two quick points. This one you mentioned about the importance of in the scaling of the cooking, clean cooking, and also meant this one. So one key differentiator, we have two targets under the SDG 7, clean cooking and clean lighting. And a key differentiator between these two, we see a lot progress happening in terms of clean lighting, but not so much progress in terms of clean cooking, or at least there are some progress, but not as good as the clean lighting. The key differentiator, I think, is the behavioral aspects of clean cooking. That means in lighting, that means you provide you are anyway shifting from an unclean lighting to a more cleaner, bright lighting. So there is no, as such, no behavioral aspects associated with it. But in case of clean cooking, every day you are interacting with the cook stove. Whoever is cooking food is having a close interaction with the cook stove. So unless the stove design, the stove performance is in line with the requirement of the person who is cooking, the same cook stoves cannot be used for, say, cooking something in India and cooking something in Ethiopia, or cooking something in a different country in, say, Indonesia. So depending on food habits and other things, the stove design also has to be accordingly made out. In case of lighting, the same bulb can be used everywhere. This one, it provides the same light. So that's a very important thing that we sometimes miss out while discussing many of these things. The other thing about that the other two panelists also mentioned is the fuel stacking. So what is important is not whether the household, earlier we used to say that fuel stacking is creating a problem, but now we say that fuel stacking is fine as long as all the fuels are clean. This one, so a house may have 4 different type of stoves, but all the stoves should be clean. So that is the key part. Instead of having only one type of stove, which anyway in urban houses we have 3-4 different type of devices, right? LPG, microwave, electric cooking, many other things on this one. So why not rural households also have different type of devices? Depending on their food requirement, they will use different type if that their affordability or if their income permits to have them. This one, what we should see is that they don't have anything unclean in that stack. As long as it is there, then I think there is no problem.
Yeah, thank you so much for this. I'm interested in the socio-economic inequalities and the differences between different cultures and traditions. What these social aspects and economic aspects should be considered in and cultural should be considered in our transition to ensure that we are providing clean cooking solutions that fit with all communities. So thank you so much, Professor Khalid, Dr. Winlow, and Dr. Matthew for your discussion today. And Shital, over to you now. Thank you.
Thank you so much, Yasmin, and to all the panelists for today's session. And rightly, like Dr. Palit said, that if you're talking about cooking, I think switch, a word like transition is more better suited than switch like, which is more suitable for lighting. And I think moving towards a cleaner stack for cooking is something that we should aim for. Thank you to all for today's session, and I think we had a lot of inquiries about the slides and information shared in this session. So just want to repeat that the recording would be live in a couple of hours from now. We've already shared the link, and I think that should suffice to all the things. Thank you so much to all of you for joining us today. Thanks.
Thank you, Shital. Thank you, Yasmin, and all my co-panelists.
Thanks.
Thank you, everyone.
Thank you.
Thanks, everyone.